Thank you so much for turning out. I'm Dominique Browning, Moms Clean Air Force. Moms Clean Air Force is a group of more than 1 million parents who are across the country fighting on behalf of our children's health for clean air protections and fighting against climate change. We're gathered here because it is Asthma Day and World Asthma Day. And there are a lot of statistics about asthma that are deeply concerning. It's a major problem in the United States. 1 in 10 children have the disease, which is more than 6 million children. And every single day, 77,000 children in this country miss school due to asthma, every single day. We talk in statistics, and we have to talk in statistics because it's important for us to understand the range of this problem and the enormity of it. But any parent who has watched one child unable to breathe knows the terror of an asthma attack. And what we wanted to do with this project was bring it to life, make it real in some way. Each of these lunch boxes represents 100 children who are missing school because of asthma, missing education, missing play, and of course missing an incredibly important meal during the day. And this is our way of visualizing this complex and often mysterious disease. Asthma attacks are triggered often by pollution, and we know that heat makes pollution worse, air pollution worse, and we're very concerned that Scott Pruitt's EPA is dismantling clean air protections. We're concerned about efforts to undermine smog standards. We're concerned about efforts to curtail progress on reducing pollution from cars. We're concerned about efforts to roll back the Clean Power Plan. We're concerned about America even thinking about getting out of the Paris Agreement to at least start working globally on emissions against climate change. We know that air pollution makes asthma worse, and therefore we feel we have to do everything we can to not only bring awareness to this issue, but to strengthen air protections. We have a wonderful group of speakers today to go further into this. And I want to start with Sonya Winters, the President and Chief Executive Officer of the Allergy and Asthma Network. Sonya?
Good morning, everyone, and thank you again for coming today. Prior to me speaking, we have a very special guest. Congresswoman Carol Shea Porter from New Hampshire has joined us. Carol has a very personal connection to World Asthma Day, and I'm going to invite her now to the podium to share for just a moment. Representative Shea Porter.
Thank you, and good morning to all. As the mother of 2 asthmatics and the wife of an asthmatic, we have had our exciting moments, like so many others. Emergency rooms at 3 in the morning, wary staying up, sleeping alongside your children's bed so you can make sure that you are there ready to start the nebulizer. So it's a story that I know well, and so I want to thank all of you for committing yourselves all the time, every single day, to beating this disease. And of course we know that part of the way that we have to do this is by tackling our environmental challenges. 1 in 12 Americans have asthma, and almost 10% of our kids do. That's a pretty big number, a huge cost to our country and to the families involved and to the employers and employees. We discuss the realities of climate change, but many of us haven't emphasized the public health impacts, but that's a mistake. The effects of climate change on our health and well-being are real, and they help bring the story to people on a very personal level. That's why today, World Asthma Day, represents a critical opportunity to highlight the human costs of climate change, and especially the cost to our children, which Moms Clean Air Force and partners are demonstrating in such a compelling way here today. Look at all those lunch boxes and what they stand for. Asthma's effect on kids is a personal issue, as I said, Since my children were young, I have paid attention to air quality alerts and observed how pollution has an effect on their symptoms, always looking at the air quality index to see if they could go out and play when they were little. That's why I'm so troubled to learn that nearly half of Americans live in counties that have unhealthy levels of dirty air, either from ozone or particle pollution. We know that climate change is having a serious negative impact on our air and in turn on our lungs. Allergy seasons are longer and asthma diagnoses are rising. In addition, extreme weather, rising temperatures, and wildfires can all take a toll on people's respiratory systems. To that end, I have a family member in Florida right now who's been running around in a mask because they've had wildfires near her home. We need to address climate change for many reasons, including to save our children's and adults' lungs. In addition to climate change this year, our kids' lungs are facing another man-made threat, President Trump's budget proposal. Cutting funding at the EPA, reversing roles on ozone and America's Clean Power Plan, curtailing investments in clean energy would set us back even further at a time when climate change is already hurting the human beings on this planet, especially our children. That's why we joined together to stop policies that take our planet in the wrong direction and harm our children. Now, there is good news. We see doctors, researchers, and community groups coming together to educate and innovate, and they also talk about the issue of the air quality in our environment. And I would like to add to that all of the sprays and chemicals that are used, and we know that our children are inhaling them in bathrooms, in their own room, in cars, in schools, you know, the air cleaners, etc. There's a lot of lung irritants in our environment. It's crucial to support awareness efforts so that families, schools, and other community gathering places have the knowledge that they have to combat this. With all the great research being done, and with the continued commitment to awareness and outreach that I know we all share, we should be optimistic to take on this challenge, but we also have to work very hard to highlight this so that others see it. One day, and I tell people this is my dream all the time, I want parents to be able to tell their kids, there once was a problem called climate change, and there once was a disease called asthma. And then when we say that, we all take a deep, deep breath of relief, a big sigh of relief, and nobody starts coughing. That's my dream. Thank you very much. Thanks for being part of this. Don't give up, don't start, don't ever stop fighting this. Our children are counting on us. We are the people we've been waiting for, and the good news is we're here together. So thank you for inviting me, thank you for the hard work, and let's go out and keep educating and keep demanding that we have clean air for our lungs and our children's lungs. Thank you. Thank you. Good to see you.
Thank you, Congresswoman Shea Porter. She's such a wonderful advocate, and we've worked with her for years, so we're excited that she joined us here today. I am Sonya Winters, the President and CEO of Allergy and Asthma Network, and it is certainly an exciting day for our organization, World Asthma Day 2017. Thank you all for coming and for being an important part of this event. At Allergy and Asthma Network, we work daily to end needless death and suffering due to asthma, allergies, and related conditions for the greater than 25 million Americans living with asthma and the greater than 50 million Americans living with allergies. Sadly, 6 million children in the U.S. are currently diagnosed with asthma, and it is the #1 reason children miss school on a daily basis. Today, as we stand in our nation's capital to raise awareness, 77,000 children will report absent from their own school day. In fact, as the mother of 5, my own children are represented here today by these lunch boxes and lunch trays. They are a powerful visual indeed. It is true, asthma is due to both genetic and environmental factors, and that is why we at Allergy and Asthma Network are partnering with Mom's Clean Air Force and others gathered here today to raise awareness of climate and its impact on lung health. Clean air is a universal human right. We must continue to tell our state and federal decision makers to stand strong in defense of clean air policies that protect our environment. This is simply about people, not about politics. Climate change is real, and we can no longer deny the science. We live in an ecosystem that is dramatically changing each and every day. We are experiencing longer, stronger pollen seasons and more extreme weather events. Both of these wreak havoc on those individuals living with asthma. From climate change to biodiversity to deforestation and biogeochemical flows, we must stop breaching the boundaries that have been set by Mother Nature. Sylvia Earle, renowned oceanographer, sums it up best when she says, "What we do right now, or what we fail to do, will determine the future, not just for us, but for all of life on Earth." Thank you again for coming and sharing today with us, and thank you for your advocacy efforts.
Thank you so much, and thank you to the Allergy and Asthma Network for your amazing vision and support and education. Your efforts are so important. Next, I want to introduce Rolando Rodriguez of Breathe DC. Rolando is the founder and president of Breathe DC, which is working to prevent lung disease in Washington, D.C., especially in communities affected by health disparities. Breathe DC advocates for stronger laws and policies to safeguard healthy air and protect lungs from smoke, air pollution, and allergens.
Thank you. This way. Good morning. Thank you very much. It is our pleasure to be here today on this great day, World Asthma Day. And this also, yesterday, started World Asthma Awareness Month. I want to say something. I want to say on behalf of Breathe DC, we're a member of the DC Asthma Coalition, and also the DC Asthma Coalition will bring you greetings. We know that politics is all local. Everything is local. So here we're talking about DC, Washington, DC, the nation's capital, and about the issues that affect asthma. I want to thank Mom's Clean Air Force for allowing us to partner with you and to bring greetings from Breathe DC and from the Asthma Coalition. The Asthma Coalition is an organization of over 80 different members from organizations and individuals who are concerned about asthma and who care about the fact that people are dying of asthma daily around the country and in Washington, D.C. We have here in the District of Columbia over 18,000 people with asthma, little kids with asthma, and over 52,000 adults with asthma. So it's a major problem for us in the district. Today we commemorate the whole idea of Asthma Awareness Month and Asthma Day. And it's part of the global initiative for asthma, the GINA, which commemorates that throughout the world. And this year is asthma, better air, better breathing. That's the theme of this year's whole Asthma Awareness Day and Asthma Awareness Month. I want to say that the problem that exists in asthma in the district is very, very important to us to understand and continue to fight against. Because we have asthma as being the leading cause of absenteeism in the schools, and these lunchboxes demonstrate that. We have over 13,000 kids, who are eating lunch every day, and just in the District of Columbia through those lunchboxes. So it's a major problem. 18,000 kids with asthma. But not only absenteeism is a problem, but also hospitalizations, and also the whole concept of kids going to the emergency room for care for asthma. Asthma is very preventable. It's preventable if we have clean air, if we have environmental factors that are positive in the kids' environment. In the home, if there's no dust dander, if there's no dust mites, if we don't have rodents, which is a major problem in the district. So we can fight asthma with treatment, with education, and with asthma action plans. So we commend Mom's Clean Air Force for bringing this event to the Capitol and for calling attention to all lawmakers that asthma is an epidemic in the United States. And here in the District of Columbia, it's a major epidemic, and it's a major factor in the economy of the district. We found that over $60 million every year are spent because of asthma, whether it's school absences, whether it's morbidity, mortality, it's all caused because of asthma. And we could solve this problem, and we should be able to solve this problem. There's no reason why we working together cannot beat the asthma epidemic and have asthma not be the environmental problem that it is. Well, thank you very much for your kind time. And just want to mention that Breathe DC, we have major programs to address asthma. We have Camp Breathe Happy, which is a camp that we have every year for kids with asthma. We have Everybody's Program, which is education in schools. And we also have a program called Breathe Easy Asthma Visiting, which visits kids at home and deals with environmental issues in the home. So we're doing our part, but it's not enough. We need everybody working together. Everybody working together, calling attention and fighting this asthma. And I want to say one other thing, is that big tobacco is a problem. It's a major problem for kids with asthma, because we found that in a recent study that 63% of kids going to the emergency room has somebody in the house who smokes cigarettes. So we have to fight big tobacco, because it is, especially in the community east of the river, Ward 6, 7, and 8, in the district where poor people live, it's a major problem, especially for kids living with asthma. Thank you very much, and God bless you.
Thank you so much, sir. And you're right, we can fight this, we will fight it, and we will beat it. I want to introduce next Charmaine Anderson, who is a Maryland mother with asthma. She's a mother to children who also have asthma, and she works tirelessly as a patient advocate to raise awareness of the disease, especially among those in underserved communities. Charmaine?
Good morning. My name's Charmaine Anderson, and as referenced, I have asthma and my children have asthma. The disease has been a part of my life, my entire life. As a young child, I recall repeated emergency visits to the doctor because I could not breathe. I lived in an apartment with my family and pet dog, with wall-to-wall carpeting, window seal leaks, and occasional insects. This was my home, and that was my normal. My mother even smoked in my younger years, but quit the habit after many complaints about the smell and me not being able to breathe well. There were no conversations in my home about what an allergen trigger was, or what changes in our apartment would support an allergen-free home, or limiting my outdoor activities during poor air quality days to lessen my asthma episodes and prevent frequent trips to the doctor. Growing up in my neighborhood, playing outdoors with friends until the street lights came on was a way of life. The summertime heat and humidity and days of smog and pollen were just conditions you lived with and lived in. However, as my asthma brought on frequent wheezing and coughing bouts, my days outside became less, and missed school days became greater. On days when it was extremely warm outside and the pollen counts were high, I found ways to enjoy indoors. However, as a child, I truly wanted to be outdoors with my friends at the playground, riding bikes, playing hide and seek, or chasing after the ice cream truck. I never thought limiting my outdoor activities would be a part of my life. I wanted the ability to breathe in and breathe out without limits, but I realized the air we breathe can sometimes make it nearly impossible to do so. Through the years, I worked with my doctor to understand my asthma, recognize my triggers, and learn how to manage the disease. For example, as a runner and a golfer, I monitor the air quality index and pollen counts and adjust my time outdoors as necessary. And today, working as an advocate with Allergy Asthma Network for asthma and allergy patients, my goal is to increase the level of understanding about the disease, particularly in underserved populations. I want to encourage the asthma community to not limit pursuing their interest and participating in activities due to anxiety about asthma. However, we all must be vigilant in protecting the air we breathe, as changes in our climate and poor air quality can make it difficult and hurt those of us with chronic respiratory conditions. And raising awareness on issues pertaining to climate change and air pollution is critically important to ensure policies and regulations support and protect asthma patients, and their families. We all can make a difference. Thank you.
Thank you so much. I always find it very moving to think about children who can't go outside to play and mothers who have to look at air quality indices every single day to see if their children will be safe. This is not the country we want, and this is not what we voted for. Our last speaker is Katie Huffling of the Alliances of Nurses for Healthy Environments. Katie is a nurse midwife and the director of the Alliance. And the Alliance promotes healthy people and healthy environments by educating and leading the nursing profession, advancing research, incorporating evidence-based practice, and influencing policy. I always love the sight of Katie and her nurses joining us to let Washington know that we did not vote to make America dirty again. Katie.
Thank you. And thank you to all the partners that are here today. All of us are working so hard on climate change and clean air and healthy lives for all our kids, and it's so great to see all of you here today. I'm here today to give a voice for the almost 4 million nurses from around the country who want to prevent another kid from having an asthma attack. We are caring for patients whose lives are deeply impacted by this problem, and their numbers will only continue to grow unless we take strong action against air pollution and climate change now. Imagine how scary it is for a child not to be able to breathe. When a child is having an asthma attack, every breath is a struggle. It's unconscionable that over 77,000 kids miss school every day due to asthma. Missing school makes it very hard for these kids to succeed and to reach their full potential. We have an epidemic of childhood asthma in this country, and this is only going to worsen if clean air protections are rolled back. Clean air is essential for healthy lungs. And as the climate warms, we'll have more days with high levels of smog when kids with asthma can't play outside. Our kids should be able to run and play without having to worry that they won't be able to breathe. Just about a year ago, I went to an event at an elementary school just down the street from here. We were there to celebrate a program spearheaded by the school nurse. It was their participation in the EPA school flag program. This program uses colored flags that represent the daily air quality to easily show the students and community how the air is on a given day. The kids, especially those with asthma or other respiratory issues, are taught how to safely play outside when the air quality is poor. At this school, putting out the flag every day was the job of the fourth graders. They were so proud of the important job they had been given, and the kids were excited to show off their knowledge about air quality. While it's great that this program exists and help these kids be able to play outside at recess without risking a trip to the hospital with an asthma attack, it's unfortunate that we have to keep track of the air quality instead of just running outside to play. As a nurse, it's my job to safeguard the health and well-being of those we serve. For kids with asthma, one of the best things that we can do is to support clean air and initiatives like the Clean Power Plan. That's why today on World Asthma Day, I'm here asking Congress and President Trump to put the health of our children first and take strong action in support of clean air. Besides being the right thing to do for the health of our kids, it makes excellent financial sense. We spend over $56 billion a year treating asthma in this country. Clean air protections can significantly reduce these costs. We are in a public health crisis, and our children and future generations are counting on us to take strong action today. We need our leaders to put health first and support clean air for all of us. Thank you.
Thank you very much. Are there any questions? Thank you very much for joining us, and thank you very much for every single week doing what you can to let your legislators know that we want clean air. Thank you.